There also is an FDA-approved injection called Vyleesi, Vyleesi. Now, Vyleesi works in the brain. You inject yourself, it's like an Ozempic injection, a tiny little needle, maybe an hour before you want to have sex, and it lasts for about 15 hours, and it releases a huge amount of dopamine. So you really, really, really want to have sex, and even the following morning, you really, really, really want to have sex. Some patients will use those, especially if they're going away for a weekend and they just want to know, like a security blanket, they're going to be jonesing for sex. Whether it's covered under your insurance is a totally different matter.
All right. Well, it's a real pleasure to have Dr. Maria Sophocles on the show today. Welcome.
Thank you so much for having me, Zora. It's great to be here.
So, Dr. Sophocles, I love that name, Sophocles.
I don't know
You're
what-
a gynecologist and you have devoted your career to women's sexual health and menopause. And I want to start first with your idea of the bedroom gap. What does this mean, and what exactly are you seeing in clinical practice that led you to realize that this gap even exists?
I was a board certified OBGYN for many years, and as happens to lots of doctors, my patients aged with me. And as women were getting older, they would kind of hesitantly share that they had lost their libido or that sex had become uncomfortable and that they were suffering from dryness and that they were frustrated because they didn't feel that their male partner really had the same issues, that their partner still wanted sex all the time. A
Because
study
they got Viagra.
that's part of the book. There's a chapter in the book about what I call Viagravation, which is the fact that Viagra will allow a man to keep an erection, turn back the clock, so to speak. But for women, we sort of sexually age out, or so we think we are. And that so many women were unaware that number one, they weren't alone. And number two, this gap in expectations and abilities can be closed
Mhm.
if you just communicate and work on the relationship and also maintain your vaginal health, which is actually super easy to do. It is super easy to turn back the clock ourselves on those effects. So the bedroom gap is that difference in abilities and expectations sexually between men and women, but there can be bedroom gaps between female partners also if there's a misunderstanding or miscommunication about what's happening to our bodies with age.
Yeah, so that's interesting. The bedroom gap. I've never heard of that before, but I think when I interview most sexual wellness or sexperts out there, they do talk a lot about this mismatch. Something's going on. Why? And it's
Right.
usually the male partner. I mean, it sometimes happens the female has got more libido than the guys, or like you said, same sex. But that's a big problem. And as we go through menopause, I want you to kind of take apart the biopsychosocial model because, like you said, it's easy to do the bio stuff, like the physical stuff. If you're feeling vaginal dryness, there's tons of stuff out there for that, painful sex, but or libido. I mean, some people go to testosterone, but sometimes it doesn't work. So, what are you seeing in your clinical practice is working the most, and what's the most effective and the quickest? And then what are some of the outliers having to deal with?
So to answer a bunch of your questions, the reason you may not have heard of the term bedroom gap is it was coined by me. So the other sexperts in the country aren't necessarily using it yet, but psychology classes are already starting to use it as they teach about sexual dysfunction. And Oprah certainly said it's an official term, so it must be an official term. I count her more than Merriam-Webster dictionary. And I think that you gave this very important term, biopsychosocial. It's a mouthful. I remember learning it in medical school. I didn't even really like the term because I thought it's not something I can teach my patients. It's too scientific, it's too textbooky, but it actually makes sense that sex is complex, right? There are biological factors that happen to us with age. There are biological factors that are at play sexually. There are psychological factors. How do we feel about ourselves? How do we feel about our partner? And there are social factors. Why are we having sex? Is the relationship one of mutual attraction? Are we having sex because we want to get pregnant? Are we having sex and hoping we don't get pregnant? And what's the science of attraction, even? And it's actually fascinating. I mean, we could talk for hours about the neurochemistry of that and the relationship of dopamine to all of this. Dopamine is what our brains secrete when there's something exciting or novel to us. So sexual issues can be a combo of biological things like lack of estrogen, which really affects our ability to create moisture, because when we lose estrogen, then in the vagina we lose blood vessels. So if anyone out there cares to look up TED Talk Maria Sophocles, you'll see a cool animated video of what happens to the vagina when we strip estrogen away from it in menopause. You lose the ridges, you lose the blood vessels, so you can't get wet, and you can't, it's not as stretchy. I mean, basically our collagen gets replaced by a crappier quality collagen. So we're sort of stuck biologically with aging. That's a fact for all of us. But as you said, those things can be improved. The other stuff needs work. I mean, to be honest, we need to understand the importance of communications with our partners. We need to find clinicians who will understand this. Remember, most clinicians in this country, doctors, PAs, nurse practitioner, most of us were not trained either in menopause or sex. So unfortunately, if you're getting dismissed by a doctor or a clinician, it's not just that they don't care, it's that they weren't trained. They weren't even trained to talk about sex. And then remember that societally, we still live in a kind of prudish society. It seems like sex is everywhere, right? But in the bedroom or in between partners, there's still often not good, honest communication between partners. Most people who come into my office say to me, I've never actually really talked to my partner about the fact that it hurts, or the fact that I don't like it when he licks my ear, or the fact that I don't want to try that thing that they keep asking me to do. For some reason, we aren't comfortable talking. We don't practice talking about sex. So I actually encourage couples to have a sort of sexual checking in quarterly, annually, monthly, weekly, whatever cadence works for your relationship. And that can be something as simple as, I really loved last weekend when we did this, or when we were making love and you did this, or I love that you surprised me by putting candles in the bedroom when we came home from work and I had such a lousy day, and it just made me remember that there's still space in our lives for intimacy. A simple statement like that can really help your partner understand that you care about sex. Maybe it's not great now, but you'd like it to be, or maybe it is great and you'd like more of it. So I think we have to combine biological help, get vaginal estrogen, or use lube, or use hyaluronic acid. Combine that with, how is my communication around sex? And if I'm struggling with that, it's okay to ask yourself, where did that come from? Did it come from schooling or church or your parents? Did it come from an assault? I mean, we bring so much baggage to ourselves as adult sexual beings that sometimes we need to unpack that baggage professionally. Sometimes shouldn't be shameful to say, I need to talk to someone about why I don't want to have sex, or why I've never really had an orgasm. I mean, I think we're not good at self-care sexually.
There's so much to talk about in terms of the biopsychosocial part. And if you're trying to figure out, why am I not attracted to my partner, or is it menopause? You see all these funny reels out there where she's like, I just, I don't like the way you smell. I don't like the way you chew. Hormones going crazy. And it's like, I love you, but there's something about your aura. Like,
Just don't want anymore. I want to watch TV at night.
pinpoint it, like what exactly it is, or and is it menopause, or is it something deeper? And when doctors aren't trained for this, I mean, who do we I never think about talking to my doctor about sex other than if it were biological. If I were to talk about my feelings and my relationship with my husband, I just don't think she or he would be equipped
Most
for that. So
won't.
I would think, oh, I need to go see a sex coach or a therapist, or but is that person trained in estrogen, vaginal estrogen, or if it like you, it's almost
Right.
like you need.
That's why I had to get trained as a sexual counselor, because I felt that as just a gynecologist, I was failing my patients. And some of the really good sex counselors and therapists in my area, lean on me for the bio part. So we both have felt struggling, like we weren't giving enough to our patients. And I think a lot of patients, if you say, I'd like you to see a sex therapist, they say, oh, wait, no, I'm not strange. I'm not a sex porn addict. They think a sex therapist is for someone who's really off the chart, something strange, or that's not true at all. Sex therapists are just therapists who have extra training in how to talk you through what is right and not right and help you get there. And there's a great website I'm sure you've posted on your site before, AASECT, ASECT, the American Academy of Sex Education Counselors and Therapists, SECT. That is a great place to put your zip code in and find someone who's done that extra training, a therapist who's done extra training. And I would really encourage your listeners to not be afraid to make an appointment with someone. If you don't like them, you're not committed to anything further.
Is
But
that somebody you see in person or is it
yeah,
telemedicine?
well, I'm sure some are telemedicine and some are in person. So I would go on the site, put my zip code in, and if five names pop up, you might have to make some phone calls or look on their websites. I don't think everyone does telemedicine, and some people only do telemedicine. So we live in a different era now. It takes a little more searching for what you need. But I think it's really lovely to find someone who's comfortable and has extra training just in things of a sexual nature, because I'm telling you, most of the clinicians are going to let you down.
Are the people who are registered on this website, they're doctors or are they just
No,
everything?
they're not. They're therapists who've done extra training in sexual counseling, so that if we all think it's okay to go to a therapist for depression or anxiety, but most of us don't realize we can go to a therapist for sexual issues such as my partner had an affair and I'm not sure how to get back into the relationship. Or I'm a widow and I have never had sex with anyone but my husband of 30 years and I'm scared to even go online. How do I do online dating? I mean, these are things I handle with my patients, but that's because I've done extra training. Most gynecologists are not going to be able to talk like that, right? Even most gerontologists, most family practitioners are not going to feel comfortable spending an hour talking about where you're starting from and where the fears are from and what did you do with your husband for 32 years and what was good and bad. Do you know your anatomy? Have you masturbated? I mean, these things take time and they're delicate things. So that's why I like ASECT, because it's specific therapists who talk about this stuff all day long. I mean, we live in a weird time, right, Zora? Because look at internet dating. It's changed how we meet people and it's made it easy to meet people right away, which means if you're 58 and you haven't had sex in 3 years and you've been divorced and you want to suddenly step back in, you're not walking into the lake up to your ankles and your knees. You're like jumping off the high dive, right? So I think it's okay to admit that it's a little scary. And like so many women come in and they say to me, I went on Match.com and within 5 days, someone asked me for anal sex. Someone asked me to do this, do that. I've never done these things. And I think it's okay to be a little intimidated and afraid of the novelty, but it doesn't mean we can't embrace some of it and say, how could I grow a little bit sexually? So my book does deal with that. My book is called The Bedroom Gap, and we talk about sex for geriatric sex. We talk about sex in marginalized groups. What's different in midlife sex for heterosexual couples, for gay couples, for disabled couples, for breast cancer survivors? How do each of these people approach where their body is now and reclaim sexual pleasure for themselves? Because we know this, that people who stay sexually active longer have lower blood pressure, less depression, and overall live longer. So it's actually not just, I mean, sex is fun and fun is good for our brains, but it actually has health benefits. You shouldn't be ashamed to say, I would like to have sex again, or I would like to have pleasure in my current sex life. I think these are two things the listeners listening here should not feel ashamed or afraid to go after.
Yeah, I think we forget what it was like maybe when you first
Totally.
dated or if you've been married for a long time and in menopause I hear a lot of women are like, yeah, it's like the last thing I'm thinking about right now is sex and libido's out. They just want to survive and that's totally understandable. But I was like, eventually, I think it's something you want to look at, not just because of the health benefits, but think about when you first met your partner or you had your first boyfriend, that excitement, that joy, that fun, those hormones running, like that was fun.
Uh,
Wow.
and
How do
it's
we
possible.
reignite that?
We
Is
can. It involves sometimes baby steps and work, but middle-aged women are used to having to work for what they want. We all know we have a wage gap and a healthcare gap. So women are used to having to work twice as hard to get half the credit for anything anyway, to be honest. So I teach my patients sometimes to just if you're like you and your partner are running around like crazy back-to-back Zoom calls or raising kids or caring for aging parents, and you think, I can't possibly give headspace to that. I would say start simple. Start with literally a 30-minute cuddle session every Friday afternoon, because Friday afternoon, nobody has their biggest meeting of the week on a Friday afternoon. And just close the door and put your phones outside that door and just cuddle in like one of those oversized chairs where you kind of have to be close. And it doesn't have to lead to sex. It absolutely doesn't. But it's the beginning of remembering what those little butterflies felt like they're just draping your legs over someone else's legs, or just putting your head here in the crook of someone's neck, or little things that I don't know, sometimes just remind us of the beauty of intimacy. And the big mic drop in among sexual experts, including myself, is that people always think they have to have desire first. I don't have any desire, therefore I have no sex life. And what we know, Zora, there's a famous researcher, Rosemary Basson, who clued us in that the whole must have desire before can have sex is wrong. That women in particular can develop desire after they're a little bit aroused. So if I'm cuddling with my husband and we're giggling and joking about something in our past, and oh my gosh, remember that time we were fooling around in our 20s, and in our case we were kissing in a museum in Colombia and the guard caught us, and it was a very strict Catholic country, and he yelled at us, and you're giggling about that, and maybe you're kissing a little bit, maybe you're not, but these little tender moments build in the female brain, and sometimes they build into arousal. And sometimes it's just someone's hand on your thigh or someone's hand on the back of your neck, and it can spark the tiniest little spark. And what we know is that once women are somewhat sexually, genitally, and in their heads aroused, then desire can follow from that. And they can desire to have sex as a result of arousal. That sounds intuitive, actually, but we don't think of it. And women come in every day going, I don't have desire. I don't care if I ever have sex again. So I guess it's over. And it's about helping them build these little sparks and these little moments. Sometimes it's just from reading a corny, cheesy beach novel with sex scenes or watching something on Netflix. And
it's
sometimes
actually, yeah, they say the brain is the biggest sex organ ever. And when you think about the mind body connection, it just reminds me of when you think of yourself eating a lemon, what happens? You suddenly salivate just by a thought in your head. So it makes sense to say, well, if you have this thought or read this juicy book, or some people look at porn. I don't know how you feel about that, but there's ethical porn, I guess. There's, you
women.
have a visual and then you suddenly have a response in your body. So it's like you said, you can have the desire and the arousal and then maybe the physical juiciness, quote unquote, or getting wet and or following, and then perhaps the desire will come. I mean, it sounds like there are many ways to skin a cat, right?
There are, and you find the one that works for you. Some women masturbate, and masturbation is a wonderful way for them to know their body. They even incorporate it into play with their partners. Other women have never masturbated partly because I think society teaches women that masturbation is for men and they can do that from cradle to grave. But women should just not touch themselves. I don't know who invented that story, but they passed it around. And I think they did women a big disservice, because I think knowing your own body and knowing what feels good is one of the cornerstones to being able to help a partner, show a partner or tell a partner what feels good to you. And as far as porn, look, porn is largely what I call big porn, like big pharma, is controlled by men, filmed by men, for male pleasure, mostly pretty degrading. Only 25% of women even orgasm in the top 50 porn videos. The most common words that women are called in porn videos are bitch and slut. So we actually have a steep hill to climb in terms of respect and dignity in porn as a gender. But there are producers like Erica Lust who are making female forward video. We
Erica
should
Lust, that's her name, Lust.
yeah, it's her real name. Oh, yeah, right. No, I
Erica
don't think
Lust.
it's her real name. In fact, she gave a wonderful TED Talk in Athens, and I would say people should listen to that TED Talk to really understand sort of the history of the porn industry and how some, mostly women, are trying to reframe it so that you and I have videos we could watch, Zora, that wouldn't be degrading. There's actually even a website called OMGYES. Oh my God, yes.
Mhm.
And real people's stories. I think you pay $25 for life. It's like crazy inexpensive. And you can listen to videos of people saying, I had trouble with orgasm, but then I figured out if I just tilt my hips, I feel better or something. Thousands and thousands of videos. And it sounds strange, but for some people, it helps them realize that they're not alone.
Mhm.
And it's not porn, it's actually just real submissions of instructions and tips and tricks. And so there's a lot out there. There's also what we call audio porn, which are mostly apps where women can listen to erotic stories. And the cool thing about these is it's personal and private. So you can put some headphones on, lie in bed at night, and whether if your fantasy is Harry Potter and mine is a hot school teacher, then we each pick our own stories and we put our headphones on and we can fantasize a little. And fantasy is something we don't make time for other than the movies, maybe, but we certainly, busy women feel like that's no longer something they can have. And believe it or not, fantasy is a nice way to kind of go somewhere else in your head and make headspace for sex.
I think it's really interesting that you've given us some great resources, and I'll try to keep these all in the show notes. And there are so many moving parts. So every time I interview somebody around sex, it's there is there are different problems that different people have. So there's what I'm thinking generally is maybe the me that I'm married for 30 years and how do you just spice it up? But then you have people who've had major sexual trauma as a childhood and they have a whole other can of worms to open up. And so there's a lot of twists and turns here, and that feeling alone is can happen to anyone, right? But there are evidently millions of people with your problem. Like you think you're alone, but you're there. So how do we tap into whatever is the issue of ourselves? Because when I interview somebody, it's like, that's it, sexual trauma. And then you have the other woman who's, well, it's not really my case. Or the other one who's saying, I don't know, need something specific and it's not relatable to everybody else. So it's like, what do we find? How do we
Well,
find our own tribe, I guess?
yeah, this first of all, in a clinician's office, it takes time. And as we all know, clinicians are burnt out. You wait 6 months for a 15-minute visit. So it's really hard. And I think it's worth you, the patient, advocating for yourself and saying, look, I know we're going to talk about blood pressure or pap smear or mammogram or whatever. And I appreciate that. Thank you for doing that. But I feel like I'm having sexual issues and I'd love to make a second appointment with you. Or could you direct me to someone you know in the community that could help me with this? That's a short sentence. It only took 30 seconds of your visit time. And now the onus is on that clinician to either say, yeah, you're right. I don't have time today because I have to do these 18 other things with you, but I'd love to see you again and talk about it. Or that's not my wheelhouse, but Dr. So and so, or the Trinity Center for Counseling may have someone. I think it's worth it to advocate for yourself. But if you get nowhere like that, you can certainly go on the ASECT website. You can look, there are influencers out there that talk about sex and sexual counseling. Emily Morse, Sex with Emily, that's a famous podcast. Just in terms of getting tips and tricks, Emily Morse has a book. Esther Perel, of course, is a famous relationship counselor. If there's been infidelity, she gives wonderful kind of ideas about how to either reinvent your relationship or accept that you're actually entering a second marriage, really, so to speak. So I think it's about finding the right resources. There's a national medical society called ISSWSH, ISSWISH, International Society for the Study of Women's Sexual Health. It's a big mouthful, but you can look on their website, and providers who are members like myself, we really like to help people with sexual issues. There are questionnaires and screeners. You can go on a Swish and take those tests, print them out. And if you score that you have a lot of issues, you can, like I said, even if you bring it to your primary care and they go, oh my gosh, I don't know what to do with that, you can say, that's okay. Who can help me? Can you help me figure out who can help me? It's a little scary to just say, go out to social media and find an influencer, because you'll
Mm.
suddenly be sold some sex enhancing serum that mostly is garbage. And be very careful of that. Even supplements, there are a lot of supplements out there for sexual health and wellness and libido. And
Aren't they usually like blood flow stuff? Just
they
blood
often
flow?
affect blood flow. Some are dangerous. The CDC has a website for supplements where you can put in a supplement and it will tell you what are the dangers and risks. Because remember, if something is not FDA approved, then it hasn't been vetted. And a huge percentage of supplements do not have what they say they have in them. That's very common and very well known. So buyer beware. I mean, there is a lot of placebo effect, and I guess in some ways that's okay. But I hate for people to spend the money on something that really doesn't have decent data behind it showing that it's effective.
Have you heard of any of these peptides? Because so I'm in the biohacking world. We love peptides. And somebody had told me about one that is you put it under the tongue. It's a little strip that melts. And it's something like SS3WI, or I don't remember what it was called, to be honest. And I tried it and I was like, well, I don't know. I guess I maybe you want to believe it. And I was trusted. My friend shared this with me and I trust her 100%. So I wouldn't do this, just go online and buy these things. But I've had other people tell me with the same strip, like, amazing, it totally worked for us. But this is just a very small handful of people I know. Do you have any experience with some of these?
I don't with that particular peptide, but I know that compounding pharmacies, and I've used these for many years for patients, can mix up a topical creams that can go on the clitoris that cause vasodilation. They contain two or three different ingredients, and they call them O cream or scream cream.
Mhm.
These don't make new cells like testosterone does or estrogen does, but they do have a temporary response, like a sort of rush of blood. And so for a lot of women, they feel this warmth and they feel the clitoris kind of more receptive to stimulation. So I think those can be helpful as a sort of short-term helper. There also is an FDA-approved injection called Vyleesi, Vyleesi. Now, Vyleesi works in the brain, and you inject yourself. It's like an Ozempic injection, a tiny little needle, right? It doesn't hurt, maybe an hour before you want to have sex, and it lasts for about 15 hours, and it releases a huge amount of dopamine. So you really, really, really want to have sex. And even the following morning, you really, really, really want to have sex. So some patients will use those, especially if they're going away for a weekend and they just want to know, like a security blanket, they're going to be jonesing for sex. Whether it's covered under your insurance is a totally different matter. It means it will be for some people and it won't be for others.
But that's a
Um,
medication. Do you need a prescription for that?
you
So,
do.
what are the side effects other than
Well, I was about to
libido?
say, yeah, the bad side effects are that the first time you take it, about 40% of women have terrible nausea and
Mm,
vomiting, which is horrible. The
yeah.
second time and after, it's much, much less. So you have to be willing the first time to just be by yourself that night, feel crappy and get through it. And then the second time you take it, you could try it with a partner. So that's pretty off-putting if you
Yeah,
ask.
yeah,
I
yeah, 'cause
know
you
I
might
didn't
feel like
invent it, so I know I'm not making you want to rush out and buy it, but I want people to know about it just in case they say, I'll try it. I'm desperate. I just really want something. I don't have a lot of people who use it often, either because of cost or because of the side effects, but I have a few people who absolutely love it.
how
They
much is it?
It depends on your insurance coverage. So I don't even know out of pocket, but it's not cheap because it's newish. And you could always call your insurance company and just say, would this be covered? If not, what does it cost? Vyleesi. The other FDA approved medication, the brand name is ADDYI, ADDYI. This was approved a few years ago. And both of these, by the way, are only approved for premenopausal women. So postmenopause, we still don't really have anything FDA approved, which is ageism writ large at the
Yeah.
FDA, in my opinion. Once you're not reproductive age, you just don't have any value to the FDA.
Yeah, yeah.
It's kind
You,
of gross.
why wouldn't this work for a
Yeah.
postmenopausal woman?
They both work for postmenopausal women, but they weren't studied for FDA approval because it costs a lot of money.
Yeah, yeah.
And so they're coming. Addie's going to get that approval. Addie is something more like an antidepressant. It works in the brain. You take it every day. So now, that's not perfect either to tell you, hey, Zora, I want you to take this every day so you have sex 4 times a month instead of three or something. It doesn't pack a huge punch. That's the problem.
It's a little bit like sometimes it reminds me of the weight loss peptides, for example, which are amazing and people are using it and all that. But what I'm kind of concerned about the person who has eating disorders, let's say, when she or he comes off of that medication, then what?
Yeah.
And I've interviewed
Yeah.
eating disorder experts before, and they're like, the problem isn't resolved. So either they're on that medication the rest of their lives, or
Right.
they deal with the problem. And this kind of reminds me of the same thing. Well, we could just have fun with it, I guess, and do
Right.
it
And
once or twice, but you don't want to be on this medication the rest of your
no,
life. Let's get to the root cause of the issue and yeah, and solve it.
and that's why I started the conversation saying there are prescriptions, but I don't start there. If
Right.
I'm backed in a corner and we've tried everything else, and the patient's got their hand around my neck saying, I want a prescription, fine. I won't deny them because I believe that their sexual health is important. But if we don't come to the root cause, is it body image? Is it relationship? Is it that your bedroom is right next to your mother-in-law's? Sometimes it's crazy, silly stuff like that.
Yeah.
And we have to brainstorm and say, once a month, you guys are going to an Airbnb down the street. That's it. We got to start somewhere. So don't forget to look at the social and relational and personal things.
Yeah, there's so many things that just, again, it's such a can of worms. And I think each person needs to figure out on their own what it is. I just had a podcast released yesterday or the day before yesterday, but by the time this comes out, it'll be a couple months. But I'm doing a program called Nine Naughty Nights with Dr. Saida Desilets, and she's got this whole sexual program. And I'm going through, I'm like, this could be fun. This is different because I've done some of the inner work stuff. I'm like, well, that's not quite me. I always do that anyways, because some women have been sexually traumatized and they got to go work on themselves first and all that. And I think those could be very valuable.
Yeah.
So I was like, okay, this will be fun. It'll be interesting. I can't take my husband. He refuses to go to a sex retreat or we can learn how to do sex, right? Let's have sex ed for adults now and learn
I
something
do
new.
that though. I mean, I do that myself with my husband, and I also really urge patients to, I mean, I call my classes sexual literacy or adult for sex ed because we do need to be retrained. Think about how crappy our sex ed was, or when you and I were teens, right? What were we taught? Don't ever have sex. You're a teenager. Put a condom on forever because you're going to get diseases. Nobody did that. The messages were so far off from how we were living as teens and young adults.
Mhm.
And of course, they never said, oh, and when you're 55 and 60 and 65, the vagina is going to be dry and your libido will leave. No one told us that. So I
Yeah.
think we actually have to reframe sex ed for women our age. But I think we should really start in teens. I think we need to change how sex ed should be pleasure focused, not fear focused. It doesn't mean be irresponsible. No, be responsible. We should teach consent. My gosh, we should teach consent. We should teach STD prevention. It's not that we shouldn't, pregnancy prevention, but we should understand, we should make sure teen and young males and females understand that pleasure is a two-way street,
Yeah.
that men and women should have sexual pleasure as part of the experience. That is so basic and it got left out of the conversation. And
Yeah.
when you look at sex ed today, almost all 47 of 50 states do not teach that. 47 out of
Really?
50. We
Oh
have
my,
3 states that have a progressive sex ed curriculum. Isn't that crazy?
that is crazy. We have got to change this because our generation grew up with porn. That's how we learned how to do it or watch the movies.
That set us up for problems too,
Yes.
because it taught men and women that women can orgasm from penis and vagina sex, which only about 20% of women even can. So that leaves 80% of women feeling broken or like something's wrong with me. It taught us that women should be able to orgasm in under 13 seconds. And even if they're standing in the back of a garage or a jukebox, or you know what I mean? Like
Yeah.
the porn messages were so
So bad.
not realistic. Taught
Yeah.
us all that women don't have asymmetry to their vulva, that the labia have to be exactly even and teeny tiny. So women come in every day and go, mine aren't even. Is that weird? Should someone cut that off for me? And can you imagine if that happened with our feet? And we were taught that your feet have to be identical and people were having foot surgery. I mean, it's really sad what porn has done to the expectation of what normal sex is. So I think we could do a good job of reframing porn, but also reframing sex ed for
Yeah.
teens. For sure. Yeah.
Yeah, we need to start, yeah, in childhood. Or actually, childhood, even babies. Heard from some of our experts say that when you have a baby just touching herself, taught the mom and dad say, no, remove the hand, don't do that. And so we get these messages from babyhood, I guess, to,
Definitely we do. Definitely we do. My friend who grew up in Ireland, this is nothing negative about anyone Irish, I'm just for context, went to a strict religious school there, and they told her, this was in high school, that masturbation was equal to murder in terms of how vile a sin that was.
no,
Masturbation was equal to murder. Yeah. And she's a totally cool woman. She lives in New York. She has no sexual issues at all, but she had to unlearn that.
yeah.
That's how bizarre the teaching was. And that was in the 70s. That wasn't the 1600s. That was in the
Yeah.
1970s. So, yeah, women get terrible shame around this. We have to unhook the shame, I
Yeah,
think.
and we still do that. I mean, if you are interested in sex or sexual, I guess, health, I mean, I've spoken about sexual health on Facebook where I typed in sexual health and I get blocked because I use the word sex and it's just it was so unfair, but that's why we have a private community now. Luckily, we have podcasts, but I think these days too, if you are interested in sex or sexual health, still in many cultures, like you're a whore, you're not a good person. And I think that message is wrong. And it's about why should we always be pleasing the man? Why don't we please ourselves, right?
Yeah,
First.
I think
I
we
mean,
have a
we
right
can
to
please the
sexual
man,
pleasure.
that's fine, but it shouldn't be first.
Not even, it shouldn't be exclusively. And I have many patients and women who talk to me and they say, I have duty sex or mercy sex, meaning I'm doing it because he has needs and he has wants and I don't want to let him down. And I love that women are caring and nurturing and pleasers, but it shouldn't be to our own detriment, meaning it shouldn't be, I'm in pain, I bleed after sex, but I kind of have to do it because he has needs. I think we should learn to talk and stick up for ourselves a little and just say, this is hurting me. This is not good for me. I'm going to go to a doctor and get some help, and I need your patience because for a while I might just want to have oral sex. Or let's find ways that we can both be pleasured, and it might not include penetrative sex because I had cervical cancer and I had radiation down there, and it really hurts.
Yeah. Well, I
And
had osteoarthritis of both hips, and we had to find other ways to get intimate because it was going downhill. And I understand that. I feel the same. Like he has some needs. I have some needs myself. Like, how are we going to get around this? And this is me in my 50s. When I think of osteoarthritis and these issues and back problems, I'm thinking somebody who's an older adult. And we know the one thing we did study in gerontology in terms of sex is that older adults do value sex and they do have sex lives. And we do have to screen them for STDs and goes on and on. But if it's important to you, again, that was important to me. So it was very uncomfortable. But I didn't want to lose that intimacy.
different positions that were comfortable. That's what I often, for patients with osteoarthritis, we often just talk about positions that allow for pleasure that don't put excessive pain on the hips and
Yeah.
the hip
Well, then you
flexors.
start associating, I don't know if this helps you, sex with pain. And I guess, well, for me, my hips, but for some woman who has vaginal pain, or so you having this negative association. So who would want that? It's not something attractive.
There's even a also unattractive word for it called vaginismus. Vaginismus is an involuntary constriction of the pelvic floor muscles with penetration because if you've had painful sex,
Yeah.
now we're going to have sex again tonight, as anything, a penis, a finger, anything is coming towards that, the pelvic muscles are smart. They say to the brain, oh my God, pain is about to happen. And the brain says to the pelvic muscles, squeeze. And so then sex hurts more. So
Mm.
that's another thing we have to do. I have to do often in my practice is assess whether that reaction is there. And
Mhm.
if it is, I often will ask patients to work with me and what we call little vaginal trainers. They're just like little silicone tampons or penises to practice gradually increasing the size to be comfortable again. And even better than a gynecologist is a pelvic floor physical therapist. Again, these are physical therapists who are specially trained in many things, including pelvic pain or sexual pain, and they work with you to teach you muscle relaxation. And I think it's APTA, the American Physical Therapist Association, APTA.com. You can go on there and say, I'm looking for a pelvic floor PFPT, and people can find someone who can help because they'll spend hours with you. You can go once a week, and that's yeah, that's
That's like
helpful.
physical therapy. Is that what you're saying? Like a
Therapy, but
pelvic.
GYN physical therapy. I mean, they put a glove on and lube and put a finger in the vagina and say, relax here, press here, da da. It's incredible what they do. And it's not always covered, it's not always free, but if you have vaginismus, VAGINISMUS, a really goofy term. But
Yeah.
believe it or not, 15% of women have that because
Mm.
they either had sexual trauma or even just non-consensual sex as a teenager, and now they're married at 32 and they can't figure out why. They just have this icky feeling and they feel so bad because they know they're healthy, but they can't get it out of their brain. So it's not uncommon. And then by the time you're 55 and have menopausal changes down there on top of it, now you have layers of issues. So it's really good to go get these undone.
Yeah. Is it any easier if people wait until menopause passes or get on hormone therapy? Because like you said, one on the other, you come into menopause with issues, whatever it may be,
Now
it's
that's
going to get
worse.
exacerbated.
Okay, let's do some good news here. Okay, number one good news about menopause is you don't have to worry about getting pregnant, right? You truly don't. Once you know you're menopausal, and that means either your FSH is elevated, that's a lab draw, FSH, follicle
What's
stimulating hormone.
what's the number to be safe?
Well, anything over, say, 30 is fine. My patient today was 127. She said, oh, I'm really menopausal. I said, but you're not really menopausal. You're just above the, right?
And
I
actually, if you're on hormone therapy, that number comes down to, let's say, 10 or 20. That doesn't mean you're going to get pregnant, by the way.
Right, exactly.
Yeah.
So having an elevated FSH or having no periods for 12 months, those are the two sort of standard old-fashioned definitions of menopause.
But if you're on hormone therapy like me, I always have this argument with my husband because I don't know when my menopause birthday is. I have no menopause birthday because I
I,
started hormone therapy while I was on full cycling. I'm
right.
55 now, and I'm
That's
assuming
true.
I'm in menopause, but I really don't know. I mean,
And
the date.
good if we were, let's say we were doing a study on you. We could take you off everything for a month, check your FSH and go back. But at 55, most women are menopausal. So we really don't need to. Women always say to me, I better get blood work. I better get blood work. You really don't need a lot of blood work for any of this. You need to be comfortable talking about it to someone who can help you. That's what you need. And then that person can examine you and say, wow, there's a lack of estrogen in the vagina. This will help. Some vaginal estrogen will help you. Or, wow, Zora, you have this vaginismus. I see you have this tension, this constriction whenever I put the speculum in, and it's pretty severe. Do you have that with sex? Well, yes, I do. Okay, well, a pelvic floor physical therapist can also help you. Or I have an aversion to sex. Everything about it grosses me out. I just put up with it for my husband, or I've never been able to give or receive oral sex, things like that. a sexual counselor is really your best bet. So I think it's knowing where the issue is and then getting the right version
Yeah.
of help for that.
Well, you've given us a lot of tools, actually. You told us about the ECT. You've talked about
Yeah.
OMG, yes, then the audio
Yes.
porn, and people can see you. I'll have a link to you in the show notes. I mean, there's Esther Perel, lots of ISSWSH website, the Sex with Emily podcast. Like, I'm very curious about her now. I'm
Yeah.
gonna,
I want people to leave here going, you know what? I got to do something. I got to
yeah.
do something. Yes, of course, they can find me through my website or Instagram. They can read the book. But I think some people want someone in their own neighborhood. And some people might have a very specific thing. You have patients whose husbands are porn addicts or whose wives are porn addicts. I mean, porn addiction's a pretty real and serious thing. Very hard to fix that yourself. You need
Hmm.
professional help for you and your partner to fix that. So it just depends. I think testosterone's another topic we should probably hit before we.
Yeah, I know, because it's like that's the first topic I mean, all the clinicians we talk to that, and it works for some and some it doesn't. So in your clinical experience, there's doctors who say it's testosterone, others who say no, it's estrogen that has a bigger impact. So where do you stand in this spectrum?
Yeah, if you're just talking about libido, my clinical experience says testosterone helps that. But I just spent a week in Orlando at the annual meeting of the Menopause Society, and we had one of the world's experts on libido and testosterone, Dr. Susan Davis from Melbourne, Australia. And she was not as gung-ho on testosterone as we all hoped she would be. She said when they really, really look, estrogen alone will help libido for lots of women because you know why? Because you sleep better. And because when you're not having hot flashes and night sweats at night and you sleep better, you just have a better overlook, sunnier outlook on life. That said, I've been using testosterone with my patients in compounded creams or the male formulation, 1/10 of the dose, for a number of years. And again, there's always placebo effect, so I cannot say 100%, but most women notice a nice gentle nudge in their interest in sex, in their willingness to initiate, or in their receptiveness to sex. So I am kind of a big fan of
Yeah.
testosterone. But I'm actually a big estrogen fan too, because I used to be on a cholesterol research team. So I know the benefits of estrogen for the heart, the brain, the bone. It's very hard not to want to spread that love.
Yeah. Interesting about testosterone. I don't know, this will be interesting if you have this in your experience, but I have been taking compounded testosterone for ages because my testosterone is low. And so I take it, I don't feel anything. I'm like, okay, this is not my problem. I'm going to be one of those people have to go and find other things. But interestingly enough, I found my husband's testosterone 2 days ago. And I said, I'm going to try his testosterone because he dropped it. He didn't want to take it anymore. I'm like, I'm not going to let this go to waste. And I started taking the first night. And then the last night, I was like having all these sex dreams. I'm like, ooh, is this the testosterone? Is it just my husband's been away for a few days? So I don't know. But, or a combo. Is it more powerful, the guy stuff? And I'm trying to take only a tiny bit, but
Gonna say the guy stuff is 10 times more powerful, 10
yeah,
times.
yeah. Well, that's why I
So
took a teeny bit.
yeah, so and it's hard to tell someone take 1/10 of a
I
tube. That's what's tricky about it. But if you try it, the male testosterone does work for women for sure. You just have to be safe at the dose because once you start getting really high levels, you start getting acne, hair
Yeah.
that you don't want in places you don't want, or hair loss right here.
Yeah.
Some women will have voice changes or mood changes, and you won't like me very much if I say, have at it, take as much as you want. And then you say, my voice is lower and I have acne all over my back. I mean, that's not super sexy. So you just have to be careful. And it's easily watched gently. Like I check testosterone levels about twice a year on my patients and just I keep them in a high normal range. So I am willing to sneak a little higher than the normal range for women because that's where we start to see the initiation of sex or the gosh, I notice I'm just more interested in it. And that just does so much good for women in terms of self-esteem and relationships.
Yeah.
And so, yeah, I would like to say, well, maybe we should worry about the safety of that. The reason I don't worry about the safety of nudging up a little higher than the physiologic levels is that if you look at trans men. These are biologic XX women who are taking enormous levels of testosterone intentionally to get a
Yeah.
beard and all that. And when you look and you say, do those men have higher risks of cancer, heart attack, stroke? They don't. They don't.
Mm-mm.
So we know if we can say those women who are now trans men can take that safely. And again, we need more data, by the way. We need to look longer at this. Then probably you and I can take a little bit extra pretty safely. I
Yeah.
mean, that's how I justify it for myself and for my patients. But I always
Mhm.
share all of this very transparently with them so that they can make the decision that's right for them. Some people are super risk averse, and some people are super proactive, progressive. Give me anything, I'm an early adopter.
Yeah.
And I'm okay with that as long as the clinician is transparent
Yeah.
about what we
And
do.
I'm a big fan of testing, measuring, and assessing, and look at your symptoms and let's see how these all align. If you're growing a beard and have acne and hair loss, well, then maybe you should
So we're
Google
doing you,
it.
yeah.
You
Yeah.
know, I mean, and you don't want to wait until you're full blown. At least I would say if you start to see those things, and then I'm like, okay, before I lose my voice changes into a deep voice because I understand some of these things are irreversible. Wouldn't want that. I wouldn't wait until I get there. And then, of course, then you test, and you're at least I've tested through serum and as
Yeah.
well as the urine is, I mean, I test everywhere. But I think, well, if I saw those levels creeping up and I'm seeing these things, well, it's a clear sign. You're just doing too
Maybe
much.
you're having too much for you, for your body. And the best testing, by the way, is serum. It's called mass spectrometry, MS. So if you order testosterone total or free, whatever you order, and it says slash MS, then you are having the best we have out there for your patients. So it's not, it's imperfect. It's an imprecise science for, I believe, testosterone is still a little bit in its infancy, even though we've been using it in the trans population for a long time. We haven't used it mass market, I think, other than we've had pellets for a long time. And so I think it's important that women know what they're getting into, know that they want to get their testosterone from people who use it and prescribe it and are comfortable with it, as opposed to sort of a hormone clinic in a strip mall where there's I don't know what they're promising, but the one near us, like the people who work there used to work at Home Depot. So I don't want people who used to work at Home Depot balancing my hormones. I mean, they just don't understand what that even means. So I do
That
think people,
even legal? Like you can do that?
I guess you can. They've opened up a shop for hormone balancing. I don't know what they're giving actually, but I've had a couple patients come to me and I think it's a little scary out there.
Yeah. Oh gosh, yeah, buyer beware. So just to wrap up with this testosterone thing, and I'll let you go, is so when you're looking at your patients and you're saying, let's do all the physiological stuff, let's figure out, let's get the vagina wet, let's get your estradiol in, or get you try some testosterone, whatever it is, those physical things. How many of those patients are seeing results? And then how many are like, okay, now we got to look a little deeper outside of the whole biological part?
If it's for painful sex, dry vagina, I'd say at least 90%, 90 to 95% of people have great response. People with advanced cancer in the GYN area who've had radiation are, it's very challenging, right? But other than that small group, we really, I mean, it's really easy to turn that clock back and to reduce the pain and bring wetness and moisture back. We also have over-the-counter suppositories with hyaluronic acid that help. We also have lube. I tell people think of lube like voting, lube early and lube often. The lube should be everybody's friend. It's not just for people who have no moisture themselves. But I think for a good 10%, it's just things are severe or complicated, or there's been trauma that they can't get past and they need usually therapy, psychotherapy. But I mean, sexual pleasure is everyone's to reclaim at any age. And you just have to find someone to work with you to figure out what are the stones you have to turn over and what's the path for you. I also have a CO2 laser in my office, is the first one in the United States. So I'm very spoiled, and that's a beautiful way to regenerate vaginal tissue with no medication. So I think in my office in Princeton, New Jersey, my patients do have a lot of tools at their disposal. We have pelvic floor physical therapy across the hall. We have a whole wall of sex toys that they can look at, and we can shop and discuss what would be for them. I think if patients can find a clinic like that, it's really helpful.
Great. Well, I'm going to have links to you in the show notes and how to find you. And the book is coming out, The Bedroom Gap, and soon. So, what's one unexpected insight that you'd hope the readers will walk away with, especially women who assume their best sexual years are behind them?
Riffing off of that, just that it's never too late to reclaim sexual pleasure. It's never too late. I have a 94-year-old patient. She brings her 96-year-old husband in for checkups, and they are having wonderful sex. And actually, women who embrace it realize it can actually be a whole second phase of life where they are less inhibited. They have, women our age have less stress about performance than, say, a 25-year-old or 30-year-old. And so if we embrace that and say, wait a minute, let this be about me and this partner and having a beautiful experience, not just I want to hook up or I want to get with this guy or whatever. And college campuses, for example, it actually can be much more gratifying sex. And I think women our age are also much more willing to say, I kind of was a giver, a pleaser, a server for 30 years. I think now I want to make sure there's some joy and fun in this for me. So I think that's the takeaway is that we all have a right to sexual pleasure, and just because you've had hot flashes or the vagina is dry does not mean the game's over. It just means go get help and communicate with your partner, know yourself, and yeah.
So many great takeaways. And I think a lot of what gets lost in the conversation sometimes is the connection. I think women generally like to have that connection. It's not necessarily the sex or great sex, but we want to get intimate. We want to connect with that person, whoever it is in front of us. And at least I know I'm a connector and I love that. And I said, well, you could have sex with anyone, I guess, or do anything, but it's not the same if you want to be connected with that person. And that's really, I think, an important takeaway.
For some of us, we've had long-term relationships. So even if the sex is meh or the vagina is dry, if we can work on communication and helping the biological part, we have often built a beautiful relationship, even if it was just co-parenting and friendship and there wasn't great sex, it doesn't mean that can't become a wonderful icing on a good cake. See what
Mhm.
I'm saying? So something to look forward to, I think.
Great. Awesome. Well, thank you so much for your time. And thank you, everyone who's reached the end and spent the time with us as well. And if you want to reach out to Dr. Sophocles or read the Bedroom Gap book, you check out her website, mariasophoclesmd.com, and I'll have links to how to find you in the show notes. So thank you and have a wonderful day.
Thanks, Zora. It was fun.